protocols have been totally abandoned.
Here I am at the Nima Market Center, where business is booming as usual. But even with the COVID-19 pandemic still in the system, the safety protocols are not being observed. Market women here say that the pandemic no longer exists.
I
believe God has taken away the virus because of the prayers we've made.
Because
if COVID-19 was truly in the system, we would have all been dead by now. I'll never get the virus. God forbid.
Outside Ghana. Oh, there be me, I reject it.
There's no virus. It's no longer in the system.
You see, you're in 2 weeks.
We were told the virus would last for 2 weeks. But it's been a year now. We still don't know anyone with the virus. The situation at the Malata Market Center is not any different. Most local traders and customers do not seem to be bothered about the rising cases.
But since that last year, this incident has happened, we haven't seen any cases that arise that maybe you see that you can just point this one, say that this one gets that infected of that disease. So as for me, I'm not sure that it has been in the system. No. If it's not there, I'm not sure that maybe I can get it.
We are tired of hearing about this virus. Our blood is surely thicker than the virus. Safety protocols serve to protect the individual and public from the harmful effects of the virus. Wearing the mask is one of them. Mask up. That's the plea of Ghana's health officers who are worried about the rising cases. Judith Awotritando for JoyNews.
Certainly a lot of misconceptions there that need to be addressed. While at the malls, measures are rather being strengthened. Mamiesi Thompson has more in this report.
The ACCRA and Marina malls host hundreds of people daily, including tenants and shoppers, which makes adhering to the protocols even more crucial now that COVID-19 cases are surging.
When you just enter, you put your hand in that sanitizer machine, the sanitizer comes out, you sanitize your hand.
Shoppers are expected to come wearing face masks, given temperature checks, provided with hand sanitizers at the entrances and other strategic spots for shoppers and also for staff.
Okay, I think it's been the same since 2020, and for someone who has been using this place since last year, I come here, I know that the first thing I have to do is use their sanitizer, and they always make sure that it's available, and every shop in the store has somebody to give you the sanitizer.
So far so good. So far so good. You know, they make sure that you wear your mask, which is very good. But I wish that they also take the temperature more.
Well, I think they've got sanitizers in place, so that's cool. And pretty much it's like, I think pretty much everyone is aware of it right now, and we're all like basically adapting and trying to make it into our new way of life. And I think we're doing pretty fine.
Marketing manager at ACCRA Mall, Anthony Asamoah, says that protection and well-being of shoppers are a top priority at all times.
The number of people coming without nose masks were a few, but right now it looks like the people who are coming are a lot without nose masks, and we have made it like a compulsory initiative. Without the nose mask, you cannot enter the ACCRA Mall. And we don't do this with any malice. We do it because we care about everybody. We want everybody to be safe, everybody to be comfortable in ACCRA Mall.
With more than 700 visitors daily, the Marina Mall has also put in place similar measures to prevent spread. Operations Manager Collins Mensah spoke to JoyNews.
Ghanaians are sometimes stubborn. We ask them to wear their face masks. them, what they'll tell you is, I find it difficult to breathe when I'm wearing the face mask, or maybe I feel so uncomfortable wearing the face mask. But you are not doing that is for yourself, to protect yourself only, but to protect everyone that is around you. So we are always ensuring that whoever enters the mall wears the face mask.
Their shoppers and tenants indicated their adherence to the protocols.
So I noticed at the entrance we had to take our temperature, and then they sprinkled some hand sanitizers on our palms. So I think everything is very efficient and we feel safe.
When I came, I washed my hand. They took my temperature. Wear your mask. It's the same everywhere.
For JoyNews, Mamiesi Nyamiche Thompson.
Well, gives you an idea what's happening here in the capital. Let me take you to the Western region now, where Inathalia Kwanzaa reports that the Regional Health Directorate is expressing worry over the upsurge in active COVID-19 cases there. Deputy Regional Director in charge of Clinical Care and Services, Dr. Emmanuel Chu Dodo, attributes the upsurge in the cases to post-election jubilations, demonstrations, as well as the celebration of Christmas and New Year. Ina is joining us live with more. Hello, Ina. What more have you gathered?
Hello, Gifty. Yes, so for the past 1 week, I have personally been making observation at the various market centers in the Western region, especially let's talk about the ACCRA Market Circle, which became an enviable place for the whole region last year, for instance. When you get there, you are supposed to see that there is a 2-meter social distance being observed by the market women. But when I went there, throughout this 1 week, my observation has been that these market women who were sent to the Jubilee Park are all back. There is no social distancing. And then the wearing of face masks, about 99% of these market women are not wearing it. For instance, again, Gifty, when you are getting to any entrance of the market, there used to be water, soap, and for people to wash their hands before they enter. There used to be a security guard in the SPMA checking people's temperature who goes in and out of the market circle. All these things are not being observed again. And then also, Gifty, some shops in the Western region in 2020, for instance, if you go there, you would be asked to compulsory wear a face mask and then wash your hands or use a sanitizer. But all these things have been ignored right from getting into the election, the heat of the election through to Christmas. All these things were not observed. So these are some of the observations I have made here in the Western region.
We've been to town here in Accra, to marketplaces, and asked traders what they thought about coronavirus. In fact, some of them think that the coronavirus is over. Some of them say coronavirus was actually supposed to last for 2 weeks. Have you had the chance to engage these traders or who comes to the market, and what are their conceptions about coronavirus?
Well, Gifty, it's true. Some of them had raised concerns that during the election, the people who came together, they did all sorts of things, and there was no announcement of hiking coronavirus. They think all this coronavirus pandemic is fake. It's something that they are just doing, especially in the market. The traders thing is the means to stop them from trading. And some people believe that indeed corona is not in the country as being speculated, even though that the regional administration is very worried. People in the region, people I have spoken to, think that is not really the case.
In the intro that I read earlier, we noticed that the region authorities seem to be worried, especially health authorities seem to be worried. But what are they doing about it?
Gifty, if you would all recall, last year there was strict adherence in the region.
Yeah.
Wherever you go, you see security authority. Even they would be checking cars and all that's going, checking if people are in their nose masks. But Gifty, I can say on authority that for now, there is nothing being done. Everybody goes about his or her own duty without any checks. They pick their cars, even though they are supposed to take the normal seats and all that. There is nothing like checking of nose masks, whether people are in their nose masks. Like, there is nothing. Even with the marketplace, there used to be security people checking the traders and those coming in and out. But now it seems authorities are relaxed, and then everyone is doing what he or she wants to do. in terms of COVID-19 protocol being observed here.
Well, Ina, we'll see how it goes. Certainly, there are figures to show that the cases are rising. I mean, the last time the cases rose, there were specific areas given, especially the mining areas, Takwa, etc. What is the story this time around before we move on to Tamale, Ina?
Well, Gifty, the story is the same when you go to Takwa, Prestia, Bogo. So everyone is ignoring the protocols. I think now that probably JoyNews, we are on it, maybe authorities would have to sit down and then enforce the law, because I can see on authority that Gifty, there is nothing being done. Everyone is going about it on normal duty, no enforcement.
Ina, thank you very much. Ina Kwanza is our Western Regional correspondent, moving around and observing what people are doing as far as COVID-19 compliance or COVID-19 protocols are concerned. I'm moving away from the Western region. We're going to Tamale right now, which is the Northern Regional capital. Residents there continue to flaunt the COVID-19 protocols of they're flouting the rules, I should say. We're joined by regional correspondent Marina Bugri. Marina, what can you report on your side?
From the Northern Region capital, I would say that most people are actually not adhering to the protocols. Now you go through the town and people take it as it's a normal day, nothing new is happening. You go into the market, like Ina said, they are choked. Not much was really done in terms of spacing in the Tamale market, and they continue to mass up in these markets. The buckets that were provided with water, we don't see that anymore. No soap, nothing to show that there's actually coronavirus, not talk of an increase. And so when you speak to people in the Northern region, they hold the notion that it is a way for government to extort money, because if they claim there is coronavirus, why did they not hear of coronavirus when the political elections were going on, when the festive seasons were going on? And now that everything is happened and they've ushered in a new government, suddenly they are talking of coronavirus. And so they think that it's a hoax, it's a way to extort money because they believe people contribute in these funds. They think that it's a way to siphon money by government. Now in the Northern region, I'm told that the TTH recorded a corona death, I think 2 days ago. But even with that, people still think that it is not true. If you come into the Northern region, except the banks and some institutions, which mandatory, you must wear a mask before you enter any other place, people go in and out as if there is nothing at stake.
Let's take a look at what authorities are doing. And I remember when coronavirus started that there was a massive focus on, on the side of authorities on getting people to comply. It looks like all that died down.
Exactly so. I mean, once the political heat started, people relaxed and then everything was thrown overboard. And so I must say that when you come into the region and when you go into institutions that really were very strict, when you go, you need a mask, you need to sanitize yourself, you need to wash your hands before you go through these institutions. Most of them are not actually enforcing these things again. And so you just walk into institutions and out and nobody's checking what.
Now, the residents from your reports, Marina, feel that the authorities actually are looking to extort or, take money from them with coronavirus compliance. And that's pretty funny. But what are authorities themselves doing about this? I mean, the regional health authorities, for example.
Yes, we tried to speak to the regional health directorate, and he directed us to speak to the public health director, but he was not available. And so we are unable to tell exactly what the region is doing now, but I'm sure that subsequent days we should be able to get an update on what Northern region is doing to combat this issue.
Certainly so. And today that we're going across the country, hopefully we're able to paint a picture of what the real problem is for authorities so that they can act. Marina Bugri there, she's our Northern Regional correspondent. To move away from the Northern region, let's head to the Northeast. Ilyasu Tanko is our correspondent there. Ilyasu, I can bet that the story is not different in your area.
Yes, exactly, Gifty. That's exactly the picture here, or the scenario here in the Northeast region. Really, this particular region, there have not been any serious compliance since the emergence of coronavirus. It was last year when when we had a peak in the country that the president came out with a directive. It was then that the overlord of the area himself, came out to make a public announcement supporting the protocols, the compliance of the protocols as announced by the president. It was at that time that when you visit hospitals and other public institutions, you realize you found you'll find people wearing masks, and you'll find Veronica buckets stationed there where people will be washing their hands. But as I talk to you now, it's very difficult seeing these signs. And so, and Wale, for instance, where I am, you go into the public institution, you will not see the Veronica bucket station anymore, and people barely wear nose masks. Only a few that are going into maybe public institutions like banks they are compelled to wear the nose mask. But I can see that the compliance has been very, very low in the region here.
Ilya, so that's one thing, though, that I, from my coverage of the northern part of Ghana, noticed that when it gets to January, in the Harmattan season, you find people actually wearing masks. I mean, how do we compare that to what is happening right now? And they were wearing the masks because of the weather, the dryness in the weather back then. Does it mean that people are not even wearing those masks that they used to wear?
Yes, I can see people wearing nose masks. Only a few, like I said. You see sometimes in a public vehicle, you see only a handful of people having their nose masks on. Largely, people don't wear nose masks. It's quite different because of the perception people have created about this particular virus. You remember when the first case was recorded here, the family member rejected, and there were confrontation between the family members and hospital authorities.
Yeah.
And because of the way the authorities handled the matter, people really think that this particular coronavirus story that they are hearing is a myth. And so it's very difficult for them to take this particular virus serious and follow the safety protocols here.
I asked Martina whether or not authorities are doing anything. She says it's been difficult for her to come through or to get through to the regional health directorate, for example. Is there any success in that front on your side?
Well, this morning I was interacting with the public relations officer of the Ghana Health Service, and I asked him what measures they are putting in place, and he told me that they are still gathering reports, and so for now nothing is happening. That's what he told me, and I asked him whether they have new samples that they are testing, and from which communities, how many people, and all that, and he told me that he will not be able to give me that particular details. And only said that for now they are waiting for the report to come out before they will announce what they will do subsequently.
Ilyasu, thank you very much. Ilyasu Tanko there giving us a picture of what's happening in Northeast region, not very different from here in Accra, from the Western region, from the Northern region, which we have been. Let's take a look at what's happening in the Volta region. Ivy Sesoji is a woman there for us on that particular story. Ivy, what can you report?
Hello?
Ivy, I do hear you. Well, what can you report as far as COVID-19 protocol, safety protocol compliance in your region?
Well, I can say that not a lot of people are adhering to the protocols these days. You see people passing by but are not washing their hands, and a lot of people are not using the face mask. You go to the market, you go to public places. You see a lot of workers not wearing the nose mask. Just a few of them. Today we were at the Municipal Health Directorate, that's the Go Central, where the MP for the area, Benjamin Kodo, said he wanted to distribute some face masks, about 10,000, to encourage them to wear the face masks and then to send to students. And then we realized that when we were walking around, we saw a lot of people not wearing face masks. Those in the taxis, public transport are not wearing face masks. Even at workplaces too, a lot of people are not adhering to these protocols. You only see a few people doing that. And the health directors understand they are doing their best to make sure that this COVID-19 is under control. But as to what exactly is happening, we can't tell for now. They are unable to tell me what they are doing, but we are told they are on it and making sure that everything goes on well. With the students going back to school, the health directors said they are also, the education directors said they are also doing their best to make sure that the environment is safe for children to go back to school on Monday. But wearing of face masks and then washing of hands and all that, people are not adhering to the protocols. They are not doing it. Just a few people are doing that.
And regarding the people, I mean, I don't know if you've had such interactions with them here in Accra. They say they give us all kinds of reasons, including the misconceptions that they have that there is coronavirus is no longer there, and the fact that they think it was supposed to be for 2 weeks, and 2 weeks are over. What do people say in the region as the reasons why they are refusing to wear the masks?
Yeah, similar. Yeah, some people think that the coronavirus is over because they don't hear a lot about it these days. The updates on TV from the health directors from Accra and all that are not done these days regularly. So they think that the disease is over. It's no more there. So they are going about their normal duties without adhering to the protocols because they believe that, okay, this thing is over. Okay, some few people who still believe that it's still there try their best to adhere to the protocols, but these people are very few. When you go to offices, as I said earlier, a few people are in their face masks and are even washing their hands before they enter their offices. And it's becoming worrying and it's risky, especially as students and children are going back to school on Monday.
Well, as we said, today we're putting the focus on coronavirus, and as we've gone across the country, including the Volta region from where Ivy Setsoji, our correspondent, reports, we'll hopefully hear the new measures by the Ghana Health Service. But back here in Accra, my colleague Maxwell Agbagba was also on a different parts of the capital and reports that very few people are wearing the masks there as well as required by law to minimize the spread of the virus. Take a look at what he put together.
I'm much more concerned, and I think that people are becoming less concerned and worried about the COVID again, and that's a big problem. I mean, I don't know why people are beginning to become less afraid or less worried about COVID. So I don't know. I'm still trying to figure it out. The scare or the concern about it at the beginning. And then now, it's like people are no more worried about it. People don't care about it at all. I think, first of all, I think the government activities to actually inform people, educate people, and enforce it. First of all, when it started, they actually said that the police should be the ones enforcing the wearing of nose masks. Now they don't also care. They don't wear it first of all, and they don't also even care. And then I think people are also become tired, or people have become fed up, since they are not seeing any negative repercussions of it. So they are they don't even care again.
One thing about me, consider COVID-19. When I wear the mask, I can't even breathe well. Even though I have it in my back, I can show you. But when I use it, I can't breathe. Say, That be the problem. So even though I'm afraid to the virus, but when I wear the mask, I can't breathe. That's my problem. So even there.
Doctors have recommended that we wear the mask.
Okay, but that's
it difficult for you.
Because when I wear it, I can't breathe well. That's my problem. Even though I'm afraid, so I advise the youth to try to wear the mask so that the system will be working for us. Maybe as for me, I'm not breathing well. Maybe I think they too are not breathing well. That's why they're difficult to wear.
Because they think the coronavirus doesn't exist anymore and they haven't seen any patients yet and all those things. That's why they think it doesn't exist at all because it hasn't affected them yet and they keep saying it's something the government just brought up just to take money and all those things. That's it. But I don't think they're afraid of it at all either. Yeah, because I was checking some stuff and he wasn't able to hear me, so I took it up to talk to him about everything before coming, and I took it up and put it back on. People don't want to spend their 1 cedi on face masks, but so if people are donating face masks for them, they'll be glad to take it and put it on.
Well, what is your own story? What can you share with us? The number is 0540109009. That's a WhatsApp number. Let me get on the line now with Dr. Patrick Kumabwaji, who is the Director General of the Ghana Health Service, joining us right now so we can understand. Perhaps there is a plan. Hello, Doc. Thank you very much. Good afternoon.
Good afternoon.
I hope that you're having a very good new year, because I did wish you one.
Well, as you can see, it's not, well, I think it's still a good year.
Okay, very well.
It could be worse, but it's a good year. And thanks for your wishes. I'm sure maybe your wishes has made it.
Let's see how it goes. But look at this very worrying situation. We've been practically across the country, not all 16 regions, but we've told you the story here in Accra. We've been to the Western region. We've been to the Northern region. We've been to the Northeast region. We've been to the Volta region. The story is the same. People are simply not wearing the masks. And some of them are saying because we're not getting the updates from the Ghana Health Service anymore. Have you seen this? How worried are you?
Well, I saw a bit of it, and sorry for joining in late. Yes, I think we have been worried since around about October, when we saw a dip in the use of the mask in particular, from about 44% to under 10%. And we have since been alerting people. But of course, the numbers went down. There are reached about 6 or so regions that had not reported any cases for a long time. And so obviously, the risk perception goes down and people start applying the protocols. And just as even corporate bodies providing hand washing and sanitizers were also going down. And so, but prior to Christmas, we had created an alert during the election to ensure that people abide by the protocol, because we always have events that are very, very prone to promoting the spread. Christmas was another big one. We did about 2-3 updates to people to show them that prior to Christmas, there's going to be increased commercial activity, there's going to be crowding, there are going to be parties, etc., concerts on Christmas, and that people should protect themselves and wear their mask and abide the protocol. That did not seem to have worked so much. So what we are experiencing now is a repercussion from the Christmas and the New Year celebrations. That is why we are having these increases.
And from the political activities, the massive political activities.
You see, this disease has a very, very peculiar cycle. Within 2 weeks, you see it. So if you don't see anything within 14 days, or let's say even 3 weeks, you cannot go back and say it was the politics. During all the political activities across the country, you see, theoretically, it's very easy for you to say, because there's a lot of mass gathering, you will get cases.
But that's what the health service tells us, which is why you banned, gatherings of certain numbers. So we obviously will be kidding ourselves if we pretend as if the political activities did not add anything to the numbers we're seeing, won't we, Doc?
Well, we don't have the evidence to show that, because we also know that the gathering indoors is another matter. There's a more riskier component compared to an open door. We, of course, were worried about the political activities, but that did not seem to have shown any rise in cases. It was flat across the period.
Very well. That might be a bit difficult for people to believe, but let's not belabor the particular point.
No. Let's see. In science, it's not about what you think. It's what really happened. And we learned. Before, when we started the program, we thought that the markets and lorry parks were risky places. When we did our periodic risk assessment in Trotros, we realized that, yes, in theory there's gathering, but transmission is lower. And so it's really not a risk. And that's exactly why you're trying to get people to understand that did not. But you see, you can see Christmas and New Year, and you see what we are seeing. If you saw something like that, or if you saw something after the election, or the registration of electoral votes, we won't say so. These are all learnings. This is a new virus that we are all learning from.
I actually wanted to shift the conversation so we look at how we can deal. Yeah, how we can deal with the numbers we're seeing that is gradually crawling up. The doctors have warned that the hospitals are beginning to fill up. What updates do you have in that regard in terms of the numbers we're seeing? Is it filling up in the hospitals as we're being told?
Okay. I'll start with the positive. We started seeing a gradual increase from the 2nd of January to the 4th and now up to now. But what we've seen that we are now moved from an average of about 100 reported a day all the way to about 180. But in the last 3-4 days, we have stagnated around that same 180, 190. Okay? So we are not seeing that exponential growth that one would expect if you are getting a wave. We hope that if it persists, we should start seeing a decline. Of course, they also improve that we need to start protecting ourselves. We have to wear our mask and make sure that we don't transmit from one to another. So in the last 4 days, 3-4 days, we've seen that the numbers have stabilized, even though we started moving from 120, 140, and going up. So that's where, as far as the positives are concerned.
Okay.
In terms of our case load, and mind you, about if we have, let's say, 190 cases, close to about 140, 130 of them are all in Greater Accra. Now, in terms of the numbers who are sick, it's always a reflection of the number of people who are positive. And so once you start seeing an increasing number of positives, you start seeing the number of cases going to the hospital who are going to fall sick increasing. We've seen a gradual increase as well of the number of cases that are coming in there. As for yesterday, our assessment, we were about 60% of our beds are full. We've not gotten to that level for many, many months. And so that's a bit worrying. But we hope that now that the positive are stabilizing, we should expect the number of cases in our hospital gradually decline. The good news is that the Ghana Infectious Disease Center is working full now, and so that expands our capacity and the number of beds that are available for service delivery, should there be any further increases in numbers.
Okay.
One thing characteristic about this current strength is that it is mainly in the middle and the upper class. That is where we are seeing the numbers coming.
Okay.
Mainly in the middle and upper class. And so that's also very clear about the type of things that took place in the holiday.
What does is that this gives a little bit of confidence that the service, the Ghana Health Service, which you head, is on top of the issue, so we know the trend. I want us to talk a bit more about the plan you've put in place to deal with this, but just a little bit of clarity here, Doc. You say that 60% of our beds are full. I just want to understand the population we're dealing with now when we talk about 60%. Are we looking at the designated centers that deal with COVID-19 issues for, right?
Designated centers like the Ghana East, the Military Hospital, the Ridge Hospital, Kolebu, Tema General Hospital, Nahu, and these are the core ones that we are looking at. That's where all critical cases, severe cases are referred to, and that's what I'm talking about.
Okay, so Ga East, Ridge, Kolebu, Tema General Hospital, Nyaho. I think I missed one.
Police hospital as well.
Military hospital.
The military hospital. Military and 37 military hospital.
The military and police hospital. Did you leave out UGMC?
Yes, UGMC is doing supporting in a very small way. So we have a small critical area that we have in collaboration with Kolebu. They are managing a few cases there.
Does it mean that UGMC is not operating or functioning at full capacity as far as COVID-19 cases?
UGMC is not doing what it used to do earlier as far as COVID management is concerned, but there are other facilities that can also manage appropriately so that they can also do the construction that is taking place there. But when we use them there. So we still have few people there, but it's not the main center now. The main center is the Guides, which has almost 200 bed capacity.
And that's because of the construction works going on there?
That may be other things, but you see, you also have specialized centers like East and Ridge Hospital that are also currently doing that. But when there's a surge, obviously, all facilities will have to take part in the response.
Very well understood. So I'm coming back to the problem you've highlighted to us now. We know that from an average of 100 days, 100 active cases recorded in a day, we're looking, 100 to 180 a day. For the past 3 to 4 days, we have stagnated, which you say is a good news. But the bad news is that out of these health facilities that you've mentioned, 60% of the beds are full. What is the plan? What is the Ghana Health Service plan to deal with the rising cases that we're beginning to see?
So now they are using the Infectious Disease Center, which has it's a 100-bed facility, 5 ICUs and 16 high dependency units as well. And so that is also another expansion that will give us more room for cases to be managed. We have also recruited additional staffing to make sure that we are able to respond appropriately. And like I said, we have not reached a peak that we need to start opening up new centers, but I think our centers now currently should be able to cope, especially now that the 60% I'm talking about does not include the Infectious Disease Center, which has been opened now.
Okay.
So, but we are also ensuring that we do contact tracing and isolation. But what we want to do is to control the spread so that people are isolated quickly before they spread to somebody else. We also are supporting the private labs. We were not getting all the information early, so we are putting people there to assist them to document the positives early for us to be able to respond. And so those are some of the things that we are doing. We are also putting some of them at the treatment center. What is happening is that people go to the lab and then they walk to the treatment centers. And so we are also doing people there, surveillance people there, so that we can start contact tracing, take their contact list and do contact tracing. These are all what is happening. Greater Accra is going to start a massive campaign in all their districts to ensure that we ramp up the education for people. And of course, we engage in the media as well to also get the message out there that the virus is still out there and that people should respect the protocols.
I think that's one of the biggest problems, or one of the biggest things that we've sort of thrown to the wind, because when we engaged people today here in Accra, there is this general misconception that coronavirus has gone away, and they say it with so much conviction. There is a general misconception that it was supposed to last for 2 weeks. And I don't know if it has anything to do with the lockdown, but people seem to have had a lot of 2 weeks, and people seem to have, people feel that once your ministry and the information ministry stopped the consistent updates, that we were out of the woods. I want to find out, are we bringing back that weekly engagement anytime soon?
Well, I do hope so. Remember, in the last 3 weeks, we had about 2 such press briefings. And we intend to continue doing the press briefing. We also hope that the media will also be taking the update from the website and also making sure people get to know about it. The risk perception is that as long as people don't see people sick, we had a decline, a significant decline, and then so the risk is gone, and people were saying, oh, the disease is gone. We go to outside Accra, go to Kumasi, and they say, oh, the disease is in Accra. It's not in Kumasi, it's not in Bolga. And so it's that risk perception that has gone down that's making people more relaxed on the protection that they have for themselves. But the essence is also not to put fear into people, or also educate people that it's important that you protect yourself and protect your loved ones. And I think if people get that idea, they will actually sit up and then support the work that we're doing. And so we'll continue with the education, and thank Joy and others for also bringing out the education. And so we believe that we'll be able to
so it's not clear to me whether or not you are bringing back the weekly media engagements that sort of sensitize people about coronavirus.
No, we are going to intensify our media engagement.
Okay, how soon are we expected to see this, sir?
I'm sure if you don't see this one next week, you hear one.
From next week. What about engaging the NCCA? I mean, the last time we had this conversation, they were one of the groups that were left out, but also apparently a very essential group of people because they connected with the people on the ground very well.
I can't speak to the details of that, but I know that one of our core partners is NCCA, who are also given resources to also do, maybe you don't see them, but they do more community work. But the NCC is part of the group that has been working on the information wing aspect of it. And so I believe they are also equipped to do their work.
We look forward to hearing from you on that one and for the media engagement. But quick one, though, the vaccination or the entrance of the vaccine. We've been waiting for quite some time. What is the latest update, sir?
Well, I believe the president gave some timelines, and that's exactly what we are working on. It's about engaging, getting a safe, effective, and reliable vaccine that we can store and distribute. And then once that is registered, I'm sure, based on the present timelines, we should be able to meet the deadline, the timeline the president has given us. And a lot of work is ongoing to ensure that we get the vaccines. We already are part of the COVAX group that has applied for some allocation. We will get there. I'm sure we'll be doing additional ones that will be taken from probably the state will be buying directly and distribute to the right people and the people at most risk in that order.
Doc, thank you very much for your time this afternoon.
You're welcome.
That's Dr. Patrick Kumar-Boadjeh, who is the Director General of the Ghana Health Service. Very detailed information is given us as far as our performance, on COVID-19 is. He said that earlier we started seeing a surge on the 2nd of January, and that we're now doing about 100 to 180 active cases a day. 100 and 180 active cases are recorded a day. But he said the past 3 to 4 days we seem to have stabilized, which is a good thing. But if you look at the trend, he says it is concentrated here in Accra, and 60% of our beds, hospital beds, are full as we speak.